Good morning, good afternoon, everyone. Welcome to Project Positive Planets. Welcome, Kim DeOrsey, spa and wellness experts. We have the fabulous Patrick Huey, who is the corporate spa director of Montage Hotels and Resorts, and the lovely Daniel Poland, director of spa and fitness for North and Central America Accor. Hi, guys. Welcome.
Welcome. So glad to be here this morning. Happy Monday morning.
Happy Monday. Yeah. Excited for this topic.
It's a great topic.
And I know you all are both in the middle of either openings or you have reopened and you've shut down and you've traveled this whole Rona journey with all of us. And giving your leadership out to everybody and it's just been wonderful listening to you guys navigate this process. So I thank you both.
We're so excited to have you both here and your professionalism and your insight of the spa and wellness industry. So thank you so much for your time today.
Thank you for the invitation to speak. We really appreciate that.
Yeah, so we're going to go right to it this morning and get started because we got a lot to talk about. We're talking globally. We're not just talking one county, one city. We're talking the globe. And then in a short period of time, the entire world came to a standstill. Patrick, you and I were talking about this earlier. We're all on the same playing field. How has the pandemic reshaped the spa and wellness industry?
I think one thing it did, it made us focus on what's essential in our operations. Once we all shut down and reopened, we all had to go back and really look at, if we're going to reopen, how shall we do it safely for our associates and our guests? But then what was going to be essential to the business that we reopened with? And I think we're still discovering what that is, to be quite honest with you. I think as we continue to move through this process. And from my perspective, it really made me understand the importance of that relationship between the therapist and the guest in the treatment room. That, we've had to strip away so many of the things that we thought made our spas luxury and make them important, amenities and, special little gifts here and there. But really it's reshaping the industry to focus back on what it's really supposed to be focused on, which is that experience in the treatment room. And to me, that's the silver lining here. In spite of all that's happening and the closures and all of this, knowing people who've lost their jobs or on furlough, that relationship is key. It's key to the business surviving past this time.
That's such a good point. And to that being said, it's relationship building and the therapists that are going to be able to build those relationships and trust.
Exactly. And that's the core of what we do. That's the benefit that we bring to health and wellness, is that relationship. We're not a doctor's office where you may not see your doctor, you may see the nurse more than the doctor. When you walk into a spa to see your therapist or your esthetician or your nail technician, you're seeing that person for an hour and a half, and you have time to talk and build that relationship. And that's really what people are paying for. And I'm really seeing that now. What do you think, Daniel?
Yeah, I think it's been an amazing shift for wellness and well-being. I think that when you work in the field, we all understand the importance of health and wellness on our day-to-day life. But I think when people started isolating and finding time and actually the necessity to look after their health, I think we've seen a lot of people downloading a lot of apps related to fitness, meditation. So this has changed the world. I think people are a lot more aware of what they should be doing in order to be healthy and feeling good about themselves. And I think that this is going to impact our industry because they are coming back to the spas. The spas that have reopened are extremely busy. We can see that people missed us, basically. They want us to help them in their quest to well-being. And hopefully this is going to translate into a greater importance of wellness, especially in hospitality, because we're never the big player. When we think about money, the spa is never the big money maker, except when it's a hotel that is dedicated with a super extensive spa. But maybe this is going to change even in city hotels, where we will have a little bit more wellness touch points in the guest room, around the hotel, to really bring that shift that has happened in society into our industry. So
I also, if I can jump on to what Daniel said, I think we're in a time where the sort of traditional modes of wellness aren't really functioning right now. And I think people are going to be looking more at what can I do on the preventative side to keep myself safe and healthy. And you look at things, and all the research is there on how important it is stress reduction and working out in the fitness center. And those areas are our wheelhouse. That's where we thrive and really shine. And I think, I think that's only going to accrue to our benefit over time. So I think Daniel's right. It'll be much more pervasive in the future.
Excellent. And you're right. I love that. And we're talking about the therapists, that they're coming for the therapists. What have you, how have you been able to communicate to these therapists globally? Because right now the therapists are the ones that are on the front line. Never before, it always used to be the guests come first, the guests come first. But I think this is the first time that we've had to say, you know what, our therapists come first. And how are we making sure that their well-being is being taken care of? Patrick?
We did a lot of Zoom calls when people were off from work. It was all voluntary, of course, but that really helped keep people connected. And, I think it's really important, and I know we're all Zoomed to death, but I think it's really important that we have Zoom calls with the camera on so that we're actually connecting to people. Mm-hmm. I think that's so important. And if you look at, iSpa and PricewaterhouseCoopers just did a survey for July, and we had the buy-in of our therapists. I think 83% of our therapists were ready to come back to work, and 80% were comfortable with the guidelines that we put in place to keep them safe. And I think that's really important, that what we built as an industry around reopening guidelines really, I think, contributes to the health and well-being of our therapists, literally, because they need to be safe in the treatment room because you're not 6 feet apart. But also, I think it made them feel like we actually cared about them, that, to your point, so much time had been guest. And in this situation, it's all been about associates. Let's keep them safe. Let's keep them happy. Let's keep them engaged. And so I think that's a benefit. I think that's a real benefit.
Great job. Because I know I have heard from some people that they haven't even gotten phone calls, anything, no contact or anything. So thanks for doing that for your team. Daniel, what about you?
So when you work at corporate office, you are sometimes a little bit removed from your contact with therapists. So I'm just very fortunate to have amazing spa director. And when everybody got furloughed or laid off when the crisis started, it didn't take a day before they started reaching out and creating like WhatsApp group and Zoom calls and providing them with fitness tips and wellness tips and just to stay together. I think the relationship in a spa between the therapist and the spa director or the spa team is such one of caring that I feel it's just normal that the day that something like this happened, we continue caring. It's a very particular relationship. Sometimes it's a difficult one because therapists are caregivers and they are emotional, and it takes, it's different than the rest of the hotel, but I think that it also creates stronger bonds between the entire spa team. So when situations like this happen, you just ride the wave and you make sure that you connect everybody together. This is why when now we're reopening and they are just so happy to be back, and we feel like we've never lost touch. So it's I wish I could do more. I used to be in spa operation and I missed the connection with the team. So now I can only somewhat inspire and guide, but it's very limited, unfortunately.
Well, I think Daniel's right, though. I think, and you have a global eye view of your business, of the industry. Your job is really to help inspire your spa directors who have that direct contact with a therapist. And if you inspire them, the hope and the prayers that they turn around and deliver that same inspiration to the therapist. And I'll tell you, I was just in Utah at our Montage in Deer Valley. And part of what we did there, which I think people should do once they've reopened, if they haven't reopened, or if they're shut down and going to reopen, is you have to give the therapist and all of the associates time to integrate coming back into the operation, and let them tell their stories and speak about what happened and what they experienced. We all, you said earlier, Kim, that we're all on the playing field together, but we're all having different experiences. Mm-hmm. And we're all, everyone has a different experience with this. They may have lost someone or been sick themselves. So part of that well-being is when they come back into the workplace that we acknowledge what they've been through, and we acknowledge and give them a chance to voice what they've experienced. And that's the key, one of the keys. There are many keys right now to leadership in this time of COVID, but it's empathy. And I think empathy creates well-being for people because they believe and they should know that you care about their journey.
And that's so true.
Yeah, I was going to agree with you. And I was going to raise a point too, because you both manage locations that are so diverse, from Mexico to Canada to South Carolina to Deer Park. So I'm just curious, how have you changed your adaptive leadership style through this in the different phases of reopening, from location to location and leaders to leaders?
Yeah, well, you know what? we create guidelines, but you know what? They are really guidelines because everything is so different from provinces to states to regions, and
That's
we
the tricky
basically,
part.
yeah. So we give them the tools, and then we do remind them that basically there's kind of a hierarchy of what needs to happen. And if the states is requiring you to do X, but we suggested A, well, you're going to have to go to X until, so it's kind of the general concept, the general framework is there, but then they have to basically adapt to each of the location. And for us at corporate office, it means a lot of adaptation, because then one is doing this, but the other one is doing this. Are we wearing a mask? No, we're not doing it there, but we make it wear over there. Now they want to wear gloves here, but not over there. So it's more about balancing all of this and trying to make sense. Although there's a lot of difference and we may want to go a certain directions and we feel like better safe than sorry. And then certain spas feel like it's too much and they decide to scale down a little bit. And it's all about accepting this and believing that the GM of the hotel and your spa team, they know what they're doing. And basically they will do what is best according to the locals' laws. And
we obviously have a much smaller footprint than Accor. So we really focused first on the general managers of the hotels, making sure that they understood and bought into the guidelines, regardless of where they were on the map. We decided as a company that the idea of safety first was going to have the precedent, was going to take the lead on all of this. And we knew when we first started out that we'd be ahead of where some of the states were in terms of mask wearing, in terms of gloves, in terms of temperature taking, but we decided to make all of those guidelines. We made those our guidelines for our company. And whether the state was there or not, we were going to ask that our hotels and our spas follow those guidelines. They've all since sort of moved up to where we started from, which I think is good. But we wanted to make sure that there was a clear message in terms of our commitment to safety. The challenging part of that, though, to your question, is when you're dealing with different cultural beliefs, you have to still have the dialogue. But at the same time, have to insist upon where you're going. So it's a fine balance when you are multiple locations across countries, states, regions. And I think every company handles it a little differently. But even if you're going to put in, let's say in South Carolina when we opened, there was not a mask requirement for that state, but there was a mask requirement if you came into the spa there. And so really armed the directors of that location with the knowledge of why we were doing it, with patience, with understanding of the guest questions, understanding also that if you have a property where people live and it's their home, they're going to have a very different response to that than if they're flying into a city location for a 2 or 3 night stay. So you have to manage a lot of different dynamics, so I think that's really important, being very clear about what your guidelines are, understanding the state guidelines and how you integrate those two. So for instance, in California, we didn't have a visor requirement for every therapist, but in California, we have to wear a visor no matter what kind of therapist you are. So we embraced that. If it upped our safety, we embraced it. If we were higher in terms of the safety guideline, we went with that guideline.
That's great.
Excellent standards, and what a way to set and lead with the direction from everybody else around the world. Right now we've heard social distancing. Social distancing is one of the preventatives, But what we do in our industry is we bring people together. We bring our staff together, and we encourage people, we market people to come see us and come visit us. How is that being done to do it safely? Daniel?
Yeah, well, we have, Patrick just mentioned, we have very strict protocol, and we have maximum occupancy in the spa. So we haven't opened all the facilities. So for example, I think it's still difficult to social distance in a sauna or a steam room. So certain places who have actually quite small of those facilities, they have not brought us back into the guest experience. So we are limiting the number of services that we offer, or amenities that we are offering. We have also reviewed the menu. We're not offering all of the treatments that we normally used to do, and also we are scattering the arrival of the guests. The lounge is only as maximum capacity. So basically, we're trying to do as much physical distancing as we can within the walls of the spa, and trying to think outside the box a little bit and see how can we take some of the spa treatment outdoor and use the outdoors in some of the resorts that we have, so we can maximize on the fact that outdoors seems to be a safe place at the moment with this virus.
And then Patrick, I know you all of California is switching to outdoor.
So we're all outdoor. We're all outdoors in California at this point. I think it's a conversation that we have a lot with the iSpa board, which is we are physically distanced, but we're not emotionally distant. And I think that is and it goes back to what I said in the beginning. You're not going to walk into a spa right now and be hugged by 5 people, which probably happened back in January, especially if that's your spa, your normal go-to spa. But the emotional connection still has to be there. And we, until we really understand what we have here, those physical boundaries have to be there to keep people safe. And that's why people are in masks and visors, and the guests are in masks, and we're reducing the treatment venues, and we're not using showers and steam. We're using showers, but not steam and sauna in those areas where you can't keep people at that physical distance. But you have to really, that's why I say you have to up that connection between the guest and the therapist, because that helps to overcome a lot of that physical barrier that we sort of have in place right now, and that we can hopefully take down one day. But it's really, to me, you deal with the social distancing, the physical distancing, by having a strong emotional connection to people when they're in the room, when they're booking the appointment. I think that's part of the reason why, we're saying it takes longer now to book a spa service, because people have questions, they want to understand. We have a lot of information to tell them, but what that's doing, on the surface, you are letting them know what's going to happen when they come to your spa. But underneath that, again, we're building trust and confidence with that guest and with that associate and that guest. So that's how you deal with the social, physical distancing.
Yeah, and it takes a special person to an employee to stand there with all, to be able to give that empathy and that comfort.
And it's not for everyone. It's not for everyone. And I think that's going to be a shifting thing that we see in our industry, is that, what we need from a person to be a receptionist or to be a reservationist is going to shift. We're going to need a person who has a high level of empathy, a high level of emotional intelligence, because we're going to be dealing with this for some time. And so it may shift the profile of that particular person, and we can't forget how important that reservationist or that receptionist is in this process.
And Patrick, you used the 2 words, emotional intelligence, and we don't hear that a lot in our industry, but that's where we need to go, is someone that is emotionally intelligent and can be comforting. Absolutely.
And that's going to be, I don't know how you test for that. I don't know what question you ask in the interview process to determine that. They have great references, but, I think we all have to, we hear the word emotional a lot in spa, but that intelligence part, that emotional intelligence, I think, is what we're going to really need to see from everybody, particularly as we go longer and longer into this process, and people get anxious and they want it to be the way it was 2 years ago, and it's not going to be. How do we handle that in real time in our operation?
Well, I think too, particularly, you're not only dealing with, receptionist job is a big job, scheduling and booking appointments. You're not only dealing with the therapist emotions about balancing the book or whatever's happening in the moment, depending on the size of the spa, but you're also handling all those heavy emotions from the guests coming into your space too, which I think particularly now, just from what we're seeing from people capturing videos on their phones and whatnot, there's a lot of emotions out there in the world coming at people.
Yeah, and all for different reasons.
Yeah.
You know, between your child not going to school or your husband getting laid off, or to someone that you know that has COVID, or someone that you know might have COVID. And that doesn't even include people that have day-to-day or going through a divorce, or their mother was diagnosed with cancer, those other layers of things. So every corner that you turn, there's some type of emotional upheaval.
Mm-hmm.
That's never been like this before.
I did want to ask, we talked on our pre-call a little bit about this, about the financial gains that you've seen or shifts through this process. So we're talking about adaptive leadership. Through your adaptive leadership of this process, what positives and negatives have you seen for your different properties?
I think I can speak on this. We've had a spa that has been open since beginning of May. One of our larger spa. It opened obviously in different phases. It was mostly nail and salon to start with, and then eventually it ended up opening the entire spa in COVID capacity, obviously, because they're not able to do as many treatments. However, in 1 month, for the month of June, basically the week after they opened, they were at 75% of the revenues from same time last year. So this is a spa that is basically functioning at half capacity and is able to reach 75% of the revenue. And actually they brought 25% of that on the bottom line. So people say, oh yeah, it's going to be hard to make profit because there's going to be so many expenses related to COVID and the complication of everything. Well, we have not seen this. And that's just an example, but we also have another large spa in the Rockies that also reopened, but they actually changed also their pricing structure, because a lot of the experience at that spa is the actual wet experience area, which is not open. So they are really treating it like a clinic. You arrive, you go into the lounge, you wait to be called to your room, you go into the room to change, you receive your treatment, and you leave. So it's really like almost like a massage clinic. It's not really a spa experience. And for that reason, they felt it was probably more, it was better to change the pricing structure. And now they're just realizing that the demand is there. And now they're just going back more and more into a more regular price, because the people are so hungry for touch and being cared for that they don't seem to have an issue with the pricing. I mean, if you are ready to go back to a spa, I think that you are ready to pay what is asked for this kind of service.
I think it's so funny. That's a great question, Stephanie, because I think it ties back to what Kim just said, because our stress levels are through the roof right now, right? And the currency for the spa industry, that's the positive for us, is that we're a place where they can come and let all of that go. And there won't be any judgment. There won't be anyone thinking they are weak. We want people to cry on the table. We want that stress to be released. It's a catharsis for the guests and also for the therapist, and it's also healing them. But that's the currency that we trade in the spa industry. And I think that's why, you know, we're seeing the same trajectories in our spas that are opened, and we're seeing it come through when we do surveys through iSpa, that the performance, the financial performance is not budget, but oftentimes we're ahead of forecast, or we're running between 60 and 75% of budget, even with a reduced capacity. That's a lot about what we need in terms of running this business, how big spas should be, how we should be staffing our spas. But the currency of our business, and again, I'm on this, I've been thinking about this, but I'm on this thing today. The currency that we trade in is the currency of human emotion. A person who is going through a divorce, or, you know, their kids aren't in school, so they're stressed out, they pay the $200 for the massage, because for that hour and a half, someone's focusing on them, someone's caring about them. And so we all have to remember, and that's why it's so important that our teams be really ready emotionally for what's coming through that door, and it's going to continue to come through that door, because that's the currency of our business.
And that we take care of those employees and those therapists. So what has your business obstacle been through all this since March? Daniel?
I think one that the spot directors are mentioning a lot is the getting the team to come back. I think both in the US and in Canada, the government stepped up and provided some funds for the people to be able to continue living without working. And for some therapists, they're actually making more money being on this program than it is coming, especially the part-time therapist. So it was a bit tricky. It's been mentioned on many calls that Patrick and I have been on, where it is hard to get the therapists back, but they also realize that this is coming to an end. I think even in the US, maybe did it get extended? I'm not sure, but I think it was also coming to an end.
It ended this month, yeah.
So then I guess the incentive to come back to work is maybe a little bit greater. I think in Canada we have extended, I think, until September, but maybe it's going to go until December. So it is about running a business and being obviously showing empathy to the people who actually cannot come back to work, because there's many reasons why you may not be able to come back. But at the end of the day, we also have to run a business, and we need our therapists to be back. So this has been a challenge where getting them back is not always as easy as we had hoped, though.
Mm-hmm.
I think that is true. I think that is, when a crisis happens, governments respond. And they try to do what's best for their citizenry. And I think that additional income coming in helped a lot of people through really dark moments. But it does put a burden on us to bring them back to work sometimes, because they do sometimes see the financial benefit of that, which brings up the question is maybe it's time for us to look at how we compensate people in our spas. And maybe time for us to revolutionize and think about that in a different kind of way. Mm-hmm. Separate and apart from that, I think the other piece that has been not a barrier, but just something that we had to sort of think about strategically how we were going to address it is, we all want to come in and give someone 3 weeks of training when they come back to work after being out for 4 or 5 months, and that's just not a reality given the financial situation that we're in right now. So how do you take all the knowledge and information and condense that into a 2 or 3 day, and if you're lucky, a 4-day training for your associates, so that they're ready to be on the floor again? And I think the thing too that we have to sort of think about is that it's not a barrier, but something to bear in mind, is that as we continue to remain open, and let's hope that we do, is that, the first guests in are fearless people, and they're going to do a lot of embracing of the things that we do. But as we continue to stay open longer and more people start to come in, they may be questioning more what we're doing. They may need more reassurance of what we're doing to keep them safe in the treatment room. So that's something to think about as we continue through this process.
I think another thing I would add to this as well is there seems to be a concept in the spa when the therapists are going back in the team that the virus lives in the front of house and not in the back of house. So for the spas who are reopening, this is something that we've had issues where it seems like as the team goes back of house, the PPs are coming off and they're sitting in the staff lounge and there's no social distancing whatsoever. So it's almost like, they're part of the same bubble, and we all have our bubbles, but this is a work relationship, and they actually interact with complete strangers in the front of house in the treatment room. And that means that they actually have to maintain the PPE and the social distancing in the back of house. And that has been an issue because they're all friends, they all know each other. They forget that this is not how it should be done. But that's I was told by many spa directors, that's a lot of work to manage that in the back.
And I think that's human nature too. That's what we're seeing across the world, is everybody's just relaxed a little bit. I mean, it's been 3 months of this. They're like, I just met my niece yesterday for the first time, and we're all wearing masks. It just seems so weird to not be able to kiss the baby. But yeah, I think everybody's starting to relax a little bit.
Yeah, and we got to be on our toes.
Mm-hmm.
Yeah, it's good that they're relaxing, right? It's good that they are becoming comfortable back in the work environment. But that's when the work gets really, focused for the spa director. You got to walk the back of house. You got to make sure that people are wearing their masks and are not, sharing food and all those kinds of things. We will become more used to this. I think that's part. We're talking about adaptive leadership, and I think part of the human condition is adaptation to the circumstances that we're in. So that's part of it. But yeah, we're saying that people get very comfortable pretty quickly. We have to just remind them.
Said March 1st, we have to wear a mask. No one would have worn a mask. But now today, you've gotten about 60% wearing masks. So we've come a long way in 4 months.
And where do you all stand with your organizations on the glove issue? Are you yes for gloves, no for gloves? Is it different at different locations, or might be the most controversial thing about 2020?
Or throwing in your gloves and saying we're not doing gloves.
I think for us, the mask is now mandatory, and I think many hotel chains have gone forward with making masks mandatory in all parts of the hotel. So for us, we always were encouraging to wear masks for the guests when they come to the spa, but now certain places where it was not mandatory, they were actually not doing that. For the gloves, we basically leave it up to the therapist and the guests. We do offer the guests if they would like the therapist to wear a glove, and if they prefer, then we put the gloves on. But it is not at the moment a mandatory piece of PPE for us.
So by request.
By request from unless the therapist also wants to wear a glove, they are of course allowed to do this, but most of them don't, and most of the guests do not want to have the gloves either. So it seems to be more of a no than a yes for that part. And then for the mask, I think we are being a lot more strict now with mask is mandatory in all spa treatments.
You know, it's so funny. Daniel and I both worked on the COVID industry response, the collaboration group for iSpa to put together the iSpa toolkit. And we talked about many controversial things, many controversial conversations, had really good, healthy conversations about them. The one thing that was the hottest topic was gloves.
Really?
It was the hottest topic.
I would like to fly on that wall.
Yeah, that's all I'm gonna say about it. But it was a really.
I know a lot of the players in that room. Yeah,
it was a really good conversation.
Yeah.
And I think our approach was similar to Daniel's. Is that we have them available if the therapist wants to wear them, or if the guest wants the therapist to wear them. In California, if you're doing a facial, you have to wear gloves, and I believe the nail technicians have to wear gloves. So if the state mandates it, we obviously follow it.
Michelle, I'm sure waxing was an interesting topic as well.
Is the glove thing new in California, Patrick, or has that always been a standard?
That was a standard when we reopened for estheticians in particular.
I just want to let everybody on the call know we do have a poll. So if you are a spa owner operator, what phase are you in reopening? Open 100%. Right now we're at 22%. Open partial, we're at 55%. Closed, reopening soon, we're at 22%. And no spas are closed with no plans to reopen, which is good.
So most of us are still kind of
Partial.
open, partially open. Yeah, that makes
22,
sense.
yeah. And then 22% is 100% opened, and 22% is reopening soon.
Congratulations to the ones that are 100% open. That's excellent.
Yeah.
And if we can ask Stephanie, where are those 22% coming from? Is it North America?
That's a great question. I know we have a diverse audience, so if you want to pop in the chat what phase you're in and where you're from, that'd be interesting to see. And if you have any questions, feel free to put those in the chat too. Thank you.
And then since March, we all had to come together and put new safety measures in. What's been one of the most innovating protocols that you put into place or equipment that you've purchased? Patrick?
Well, I'll tell you what was innovating for us, and we're just putting it into place now, is the online health questionnaire.
Yeah.
Of course, do it online, but then the facility required to make that happen is quite extensive, and to get it back and to be in line with HIPAA and ADA in terms of keeping that information private, it's a big ask if you haven't been doing it before. But we committed the resources and the brain power to have that happen. So that's been a really good innovation for us, I think, over the.
And you use that with your spa software?
I'm sorry?
You did that with your spa software?
Yes, we do it. We do it through our reservation system, and we also link it to another system that we use for mailing contracts to groups. So we didn't create a new system. We didn't buy something new, but we married our spa software with our system that we use to mail contracts out. And so the contract we mail to you is your questionnaire. You can send it back to us, and it's stored properly, and no one has access to it. So it's been really good, and it's cut out a lot of time at the front desk of our spas, filling out paperwork, and where do people have to go to fill out the paperwork, and then what do we do with the pens? And so
it's like awkward.
It's so awkward, but it's a really smart.
And so and now say a guest comes in on a Tuesday and they come back on the following Tuesday, do they have to fill out a waiver again?
They do. If they're not, so the policy we have in place is that if we're not seeing them every day, that if they come back a few days later or a week later, we're going to ask them to refill out the health questionnaire. If they come back the next day, we'll do a verbal and ask them if anything has changed with their health questionnaire since we saw them the day before.
Okay. And Daniel, what about you? What are innovating things that you're seeing in your properties?
Very similar to Patrick. I think technology has changed a lot. The way I feel like it's something we should have done years ago, and I don't know why we needed that crisis to make us get there. But we are also doing intake forms and waiver form all online. It's all secured. We're using a booking system as well for the pool capacity, because that's also a bit of an issue. Guests want to use it, but how do we monitor the pool access and the number of the time that he can spend on the pool? So we're using another app for that. Basically, we're trying to increase the amount of technology we are using in the spa and the fitness facilities. So that probably has been one of the biggest change. And our software partners have been stepping up their game. I mean, they are basically turning up with new innovations, and e-commerce is another big thing. We realized that we don't have a way of doing revenue. So when we shut down, we basically went down to zero, when in fact we could have probably have a bit of retail revenue coming in, but we were not set up, and we still are not set up for e-commerce. So now we are looking into other kind of technology players in the field to help us with our e-commerce site.
I'll tell you, Daniel hit the nail on the head. One thing that we're doing for Montage is looking at, we're going to pilot it with one of our resource partners, that they will hold our inventory. And then as they sell our inventory, we'll receive a percentage of that revenue back to the spa.
Brilliant.
So that's great to reduce the, we're all going to be stressed on those balance sheets to reduce the amount of inventory that we're holding. And that's a really great way to do it. And oftentimes it's the smart thing about having a good resource partner is that they help you innovate those ideas, and they can often create a really beautiful online shopping experience much better than a hotel can do, because that's not our mid-price hoteliers, but that's what a resource partner does all day. So they really know how to make those kinds of systems work. So if you're not doing that, look into doing it.
I have a question on the intake form. When iSpa and I got this quite a bit from our Caribbean members, when iSpa created the toolkit, is there a new revised intake form in there suggested that people could tailor?
There is, and I'm glad you brought up the toolkit, because Daniel and I did work on that together.
Thank you.
Great, awesome people. Thank you, iSpa. Yeah. But we update it all the time, so it's not a frozen document. So if you have people who are asking, are there updates, etc. One thing that we really do at iSpa is we rely really heavily on data. So that's why we send out those surveys, so that we can get, and PricewaterhouseCoopers can get a real understanding of the industry and what's happening from an operator standpoint and the consumer standpoint. So that when we get that information, we really feed that directly into that toolkit. So it's constantly being updated in real time.
Wonderful.
And they can download them and make them, we've made the templates downloadable, and they can also put on their own logos. They can make them fit their own business needs, so that they can really own what they're putting out there.
Such an amazing resource, and it's complimentary, correct? Yeah.
Yes, there's no fee, and that was a very easy conversation that we had as a board. Was that these are extraordinary times, and that information, we didn't know what it was going to be fully until we had it. We had an idea of what it was going to be, but the decision was made almost instantly that whatever we put out there was going to be for everybody. And that was one of the guiding principles of that process.
I'll find the link and I'll share it in the chat for anybody that's on this call.
Thank you. That's great.
Yes,
And I
hats
just
off
want
to
to,
you and iSpa and Limit Geese for all you've done to create and be there for you.
Yeah, Lynn's been great. And I believe we've had 180,000 views and downloads of that document. So people, that makes us happy, right? Because that means that, when we started the
People are
process,
crying.
and you say adaptive leadership, Kim, I'll tell you, that whole process was adaptive leadership. I mean, you have people at the table who don't usually share information, who
No.
are competitors, and Daniel can speak to this, but it was a sharing, was a very sharing, giving process. Don't you think, Daniel? Would you describe it as that way?
I cannot say enough good things about the iSpa group that was created. It was wonderful. I've never connected with people in the industry so much. We used to work in silos a little bit. It's almost like we own our own secret that we don't want to share. And this brought all of us together. So that document that was created is unbelievable. It helped me a lot because I was worried that I was going to make mistakes because it was a situation that I never know where to go. And then by having people like Patrick and the head of Mandarin Oriental and Marriott and all of us working together into creating this document, then there's a weight behind it that even when I share that with my operation teams at Core, I tell them this is not coming from me. This is coming from a group of individuals that have put their heads and their hearts together in order to create that amazing document. So it is the way to go, I think. It is the way to use those guidelines and then reshaping them if you have to into the specific of your operations. But it is a great document, and it's so great to be connected with people that I've never actually connected with before.
And hopefully more of this, because a lot of these independent spas out in the world don't have a lot of support, like having to write your own SOPs and job descriptions, and is such a monumental task if you've ever done it.
And I'll say, to your point, Stephanie, I think, and I think that's why what you're doing here is really important. I think the town halls are important. I think what GWI is doing is important, is that a rising tide lifts all boats.
Mm-hmm.
And, we're fortunate because we work for hotel companies that have resources, but a lot of our membership, a lot of our businesses don't. And so those types of tools like the iSpa kit, these types of forums where professionals can come in and talk and share advice freely, is really important to help that person who she may have her 1 or 2 room aesthetics business, or they may be a small 7-room, day spa in Ohio. So they're not going to have access to lawyers and medical experts, all the things that we have access to. So I think these are really important. I think, to me, that's the biggest shift, is that I feel like we are truly, and maybe ahead of the questions, I'm sorry if I am, but I feel like we're truly a global industry now, and I feel like, Jeremy McCarthy from Mandarin said it when we first started that iSpa COVID group, was that we either sink or swim together across the world. And so I think that's really true. And I was recently on the call with the African Spa Association, and they're in the same boat. We're all trying to share that information so that we all can thrive through this time.
And people have come together, and I've talked to more people now than I would have 6 months ago, and just collaborating and being there and supportive. So it's been wonderful.
Mm-hmm.
I want to circle back to Daniel when we were talking about technology. I was recently attended the CSFA conference, Club Spa and Fitness Association, and they talked about technology. And just so everybody on the group, one thing that they were struggling with is the country clubs are struggling with the older community not being able to use the technology. So anybody listening, just make sure that they don't know how to use it. They need help using it. They're setting up classes for them to use it. So technology is not for everybody.
Yeah, I was on a webinar, and the host the other day didn't know how to use Zoom. She's like, I'm trying to share my presentation. I'm like, people still don't know how to use Zoom, but apparently so.
Yes, I thought that was interesting because most country clubs haven't closed. And so they had to get this technology and adapt the technology, and they spent a lot of money on the technology, but then the consumer didn't know how to use it.
Well, golf has been one of the industries that has thrived throughout this, I know, from all of my...
And golf needed it because golf was a dying sport. So
right. It's going to come back. So.
But it's true, you have to have whatever you put into place, from a technological standpoint, it can't be too complicated.
Mm-hmm.
And that's where you spend a lot of your resources, financial and brain power, in terms of making that piece, that technology piece, really user friendly and intuitive. Because if it's too complicated, it just breaks down and people won't use it. So that's an important reminder, Kim, that if you're not using technology and you start to use it, make sure that it's very simple. Because if it's complicated, people won't, they'll just call you. It's not gonna work.
And keep calling and keep calling.
It'll keep calling.
Yes. So what are you seeing from the consumers out there and hearing from your spa directors? Like, what does the consumer want? What does the consumer need? And how can we help the consumer? Patrick?
Well, they want safety. And this is really hard to quantify because I don't know how you quantify this, but they want it to be like it was before. And we have to help them embrace the new, as we have to help our associates embrace the new. And they want spa services. When we did the PricewaterhouseCoopers survey, only 25% of respondents said they had high fear about coming back into a spa, which is still lower than going to a restaurant or flying on a plane. So people want to come back to the spa, which is why, I think those spas that haven't opened yet, I would encourage you to do the research on the financial benefit of reopening your spas, because people need that right now. They need that connection. They need that touch. They need that space away from their lives and their homes. So I think that they want that. When I say they want it to be the way it was, I mean, that's what they really want. They want that connection to still be there. They want that space carved out for them to still be there. They'll wear a mask, won't wear a mask, be in a steam, won't be in a steam. But that's really important. And we're starting to see the financial picture of what reopening has done for our businesses.
I think that there's a huge wave of people who are going to look for social wellness. I think if we step outside of the walls of the spa and we think about the broader well-being of people, I think that the isolation has created a lot of loneliness for people in the world, and loneliness has been often associated with the equivalent of smoking 15 cigarettes per day in terms of the implication on your health in the long term, right? So as people isolated for all those months and they've realized that this is not how life should be, they are going to come back to us and expect to find programs and activities. And most of them are not necessarily going to happen in the spa, but think about the outdoor activity. If you work in a resort, even if in a city hotel, do you have running maps or running apps would be even better? Do you have bicycles or e-bikes? What can you provide to your guests that are going to make them, first of all, spend more time outside, but also maybe create some kind of social groups of activities, because spa is often a lonely experience. Even if you're together in a lounge, you're not supposed to speak that much. It's kind of me time, right? But we want to think about something that we can do we time as we return to business and create really those amazing programs. Recreation is so underrated in our hotels that it should be actually elevated to where it belongs. It's the place where we connect people, cooking classes, hiking, canoeing, all of those great things that works on your health and well-being, but also create those social bonds between people. So that I think this is going to be a big shift. I hope it's going to be a big shift, and it's up to us in the hotel industry to really embrace and take the wellness out of the walls of the spa, because
I love that. And that's one of my favorite things to talk about. And I love that term, we time. I've met some of my favorite people in the world in hotels and on vacations, and that I still talk with this day. So that's beautiful.
Now, we all have gone through a tough time. And I know me being a spa director, I'm not successful unless my vendors are successful. How are your vendors doing? How are they holding up? And how can the vendors support you? Patrick?
I've been in touch with all of our main vendors, I have to say, and they're still there, which I think is good. They've managed to keep the shops open, which I think is really important. And we should be checking on them. as much as we check on our therapists, reach out to your vendor partners and really see how they're doing. I talked about the holding of inventory for us. The virtual trainings have been important. I was on a virtual training with Comfort Zone a few weeks ago, and it was just a lot of fun. Again, because it's we time, even though we're, in this virtual box that we're in. But I think, as we struggle, our resource partners struggle, So I think, and I want to shout out, especially to our skincare retail resource partners who really pivoted and started making hand sanitizer to support that deficit that we were seeing in our country at the beginning of this. So that flexibility and that willingness to think new thoughts, I think, is going to help. Again, can you embrace a new concept? And the smart retail partner resource partners are doing that. Just a lot of good ideas coming for us, coming from our resource partners on how we're going to get through this and what we're going to do when we reopen. So a lot of ideation around new concepts. So we can't do it without the resource partners. This is no way. There's no way.
Right. Daniel, we can't hear you.
What about now?
Yep.
Yeah. We spend years building relationships, so they are actually not vendors, they're not suppliers, they're really partners. And this is when you spend the time investing with companies that work with us, they are stepping up to the plate. And crisis can bring the worst and the best of people. And I can say that our product partners have stepped up, and they are helping. They know that money is tight, so we find ways to be able to bring supplies, because Patrick and I both heard that retail is flying off the shelves. So you need to be prepared for this. But if you don't have any incomes and you are low in inventory, how are you going to refill the shelves, right? So this is when partners come, they do consignment, they find creative way, because we on this for the long run. We've been with them, some example, Kristen Florian, we've been partners with this company for over 25 years with Fairmont. And this is them now stepping up and working with us, because we know that we will still be with them for years to come. So some others that we maybe have more of a vendor relationship are maybe the ones that we never really took the time from both sides to build that partnership that I call. So maybe those are the ones that have not maybe contributed as much, but most of the time the resource partner have been unbelievable.
Yeah, and Patrick, to your point, if we could each reach out today to 2 or 3 of our vendor partnerships and say hello and thank them, because I know they're working harder than ever, and they've got families at home, and they are in it with us. So I have never been successful without my vendors. I need my vendors.
No, they're fantastic. They're really fantastic, and I think, I think one word that will come out of this time is relationships.
Mm-hmm.
What are those relationships that you've invested in and built and really nurtured and developed? That's what's going to come out of this time together through this COVID experience, and it will end. It will end.
And we all have our conference stories and our memories, but we're also going to have our COVID memories and those relationships that will be going back. Remember when? Yeah.
I've done Zoom calls with cocktails with some of our resource partners. So it's important, so important.
Mm-hmm. I can't hear you.
Sorry, my dog was barking. I turned my audio off. Unless we have any questions from attendees, closing question for all 3 of you. What's something positive, either professionally or personally, that you've gained out of this experience? Because I think there are a lot of positive things we can focus on. Daniel, are you thinking?
Oh, yes, I am.
Okay. Patrick, you have one?
I think a positive has really been, and I've been thinking about this a lot because I knew you were going to ask the question, but I think a positive is the level of relationships that I've built with my colleagues in the industry. Because oftentimes it can be a very isolating existence because we spend a lot of our time just swimming in our own pools. And now I feel like we're in a big lake. Yeah. Now I feel like we're in a big lake together. And I feel like I have a much wider network of true Shakespeare said, through adversity to the stars. And I feel like I have a true network of stars, of resource partners, of consultants, of spa directors, corporate directors to rely upon. And that is fantastic for the industry and for me personally. So that's a big benefit.
Love it.
And definitely for me, I've been working at home and I never work from home, but now my children, I have 3 children, and now they're learning what I do and experiencing what I do and getting to know what I do and really intrigued and asking questions. So I feel that's so important as a parent, because normally we just walk out the door and mom's at work. But to see what we do, and my son, my 23-year-old, will come home like, "You're still working? You're still working? You're still at your desk working?" Yeah. So I think we're teaching our children worth ethic as well.
Mm-hmm.
And being resilient.
More hospitality professionals. So let's get them on an internship ASAP.
Oh, they have plenty of projects. My kids have plenty of projects and they have to help. So I think that we're teaching our children at home the work ethic, how to be positive and not to give up.
Love it.
And I agree with Patrick. I think that he nailed it on the head. It is really those relationships with the industry people that I will cherish the most. Webinars like this are fantastic. I mean, I've never done those ones before. So it's great. We get to share with them. We get to speak about something that we're all passionate to speak about. And another thing is that at corporate office, we sometimes work a bit in siloed, and I'm the only one who looks after spa and fitness. I'm kind of working more alone, but this has brought us together, and we do have weekly calls with our CEO when we have 400 people. And I created a step challenge because I wanted everybody to stay healthy, and I provide them with podcasts about happiness and about all the great stuff that they should be listening to while they're walking. So just try to bring everybody together into making sure that this crisis is not going to be worse at the end than just what the virus is actually bringing to us. But I don't want the consequences of being lonely or alone or isolated or working from home and having a bad chair and not walking enough and not eating as well. I don't want this to be an impact on the health of my colleagues. So I wanted to make sure that we connect, and we did connect, and I'm very grateful for that.
That's beautiful.
Yeah, Daniel, what podcast are you listening to? So on my walks, I look for different podcasts. So what are the happy ones?
Oh God, I love the Happiness Lab with Dr. Laurie Santos. I love her voice. I love what she said, and then because I come from a science background, I always like when somebody ties in wellness with science, and that's what she does. So she talks about a topic, and then she brings expert to confirm that studies have shown that yes, this and this and this and that. It's fantastic. I love her. The Happiness Lab with Laurie Santos. Very good.
Okay, I'm going to do that tonight when I do my walk. Thank you.
I like it.
And thank you both, Stephanie. Thank you and Kim for doing this. It's wonderful.
Thank you for having me. Listen to you and hear you and your great advice. So thank you so much.
Yep. And we'll touch base. Take care, guys. Have a great Monday.
Bye.
Bye.